You're driving home, everything is normal, you're listening to your favorite podcast, your favorite music, and boom, you get hit from behind. You get out of the car, you check the car, barely a scratch, you go home, you take a painkiller, and the next morning or 2 days after, you start having headaches, neck pain, low back pain, and you cannot turn your head. Well, this is one of the most common things that happen after a car accident. And I'm going to tell you why the 72 hours after a car accident are going to be very important to determine if you are going to recover in 6 weeks or if you are going to have chronic pain. My name is Kevin Tomassini. I'm a doctor of chiropractic, health coach, and track and field athlete. Whiplash is the most common soft tissue injury after a car accident. What happens here is that your body goes through acceleration and deceleration, and that will damage the ligaments, the muscles, the joints, and sometimes even the disc of your spine. Whenever you get hit from behind, your torso is going to go forward, your head will follow like a whip. That's what it calls whiplash. And that will create inflammation and micro tears on your soft tissues and your joints. The symptoms are delayed because after the accident, your body is full of adrenaline. And adrenaline is a very good painkiller. But after the adrenaline starts to wear off, you start to show the symptoms of inflammation and pain. Now, what are the most common mistakes that people make after a car accident? Well, the first one is they wait and see if the symptoms get better. And I get it. After a car accident, you don't want to go to the doctor or the hospital, start filling papers. You want to go home and rest. Well, let me tell you that if you don't take action in the first 72 hours, the body is going to start to heal in an awkward position. With poor alignment, is going to develop scar tissue, and that is going to hurt you on the long run. The second most common mistake is that people only take painkillers, and painkillers have a space on the healing process that will help you to feel a little bit better, decrease the pain. Muscle relaxants can help you relax the muscles, but they don't restore the proper mechanics, the proper alignment, they don't break the scar tissue, and they don't retrain your muscles. I've seen people that have been taking painkillers for 6 weeks and they still have pain because they're not restoring the physical part of the problem. Mistake number 3, not documenting everything. Very, very important that you document what happened in the accident, what happened after the accident, and any care that you have received, and that you don't have gaps on their care because that might hurt your case with the insurance companies. Mistake number 4, stopping care too early. A lot of people stop care when they feel better, but feeling better is not the same thing as fully healed. Ligaments take 8 to 12 weeks to fully restore. It might take a little bit longer, and if you stop care before you are fully healed, you might develop some chronic pain and some instability on the area. The first phase is the acute phase. This is from day 1 to 2 weeks. The goal here is to decrease the inflammation, protect the damaged tissues, and improve the mobility slowly. Here we're going to work mainly with the soft tissues. We're going to work with the SCM and other muscles around the neck. We're going to use cold therapy like ice and education of the patient. Very important that you understand your condition so you can be part of your healing process. The second phase is the subacute phase. In this phase, we're going to continue to work on the muscles to reduce the adhesions, the scar tissue, the trigger points, and add chiropractic adjustments to restore the joint mechanics. Phase 3 is the rehabilitation. After we restore proper joint motion, we're going to work on the muscles to bring back the strength, the neuromuscular control, and improve your posture. Phase 4 is the return to function. Here we want to make sure that you're moving properly, that you don't have any remaining symptoms, and that you are able to return to normal activity as soon as possible. If you were in a car accident, get attention immediately. The 48 window gap is real. People feel fine and then they start having the symptoms. So don't wait and take action as soon as possible. If this video was helpful for you, please give us a like, subscribe to our channel. Again, this is Dr. Kevin Tomassini. Let's do that here. ¿Por qué? Porque tissue, soft tissue, soft tissue injury.